Eric Fry here, delighted to be joined this morning by Dr. Jennings from St. Anthony Memorial Hospital. Doctor, how you doing today?
I'm good. I'm sneezing. That means spring is here.
Hey, as long as it gets rid of the cold temperatures like we have this morning, I'll take it.
Absolutely. And boy, it's been a beautiful few days, and I think this weekend's going to shape up perfect.
Yep, I can't wait. Get out and do some yard work. But we're here to talk, of course, about COVID-19 and more specifically Phase 5. And we've heard about this Phase 5 and getting to it and kind of getting everything back open. What are you hearing and what are you seeing?
Well, it's exciting to think that we're finally kind of getting to the point with the number of vaccines available that we've got some opportunity to talk about globally reopening. Even when the pandemic began, the crux of what it was going to take to get us to reopening really hinged on vaccination, from the get-go. And fortunately, right now, vaccine supply is really, really good, and different forms of vaccines, so lots of options for folks. And we're close. I have a celebration right out of the gate. So
Good.
One of the criteria to get to what they've called the bridge to Phase 5. So Phase 5 basically means we're back to normal operations, life's good.
Mm-hmm.
The bridge to Phase 5 is kind of an in-between from where we are right now towards full reopening. It allows much more people to attend events. It takes into consideration whether or not somebody's been vaccinated so that they then don't count towards numbers as far as participation in events and those types of things. It's really, truly is just a bridge. It just kind of opens up a little bit more, but not all the way. The very first criteria to get to the bridge to Phase 5 is 70% of all of the state of Illinois. So in these steps now, the state has to move all in one giant mass. So we're no longer treated as separate regions. But to move into the bridge, you have to have 70% of folks 65 and over having received at least one dose of vaccine.
Okay.
So yesterday, the state of Illinois hit 70.61%. So we've hit that.
Yay.
That's a yay. Unfortunately, on the backside of that, though, the additional criteria look at the number of new hospital admissions related to COVID, the total number of patients with COVID that are in the hospital right now, as well as availability of intensive care unit beds. And although we continue to be very ready to serve everywhere and have good ICU availability, the actual trends on admissions and total number of patients in the hospital is unfavorable. Mm-hmm. So I anticipate us not being quite ready to announce a move to the bridge to Phase 5 quite yet. It hasn't banked the thresholds where they're going to say no, but the trajectory is really kind of ugly. And I think the thing that's concerning there is two things. One is that the variant strains are a reality, and in fact, Effingham County Health Department announced earlier this week that we've had several variant strains of the British variant within Effingham County. And the younger population is starting to perk up and start to see hospitalizations within the younger population, which is definitely not encouraging at all. So another good reason to really talk about getting the vaccine, even if you've had the disease, because the vaccine seems to have additional protection for most of the variants. To get to Phase 5 fully, not only do we have to have those hospital metrics go in the right direction, but we need 50% of the entire population of Illinois over the age of 16 to have had at least one dose. So that's got a little more room. We're only at about 38% statewide, but that's come up a lot in the last week. That's moved up almost, I want to say 15%. So definitely making some headway. And the county health departments have just been rock stars everywhere around getting them in arms and continuing to open it up to more and more folks as they've seen increased availability of vaccine.
And even if you have the vaccine, doctor, still you should still use precaution as far as out and about. Don't be careless, stuff like that, correct?
There is still some unsolved conversation around the likelihood of somebody vaccinated still being a potential spreader. So even though you're not sick, could you actually transmit the virus to someone else? I kind of think, to me, it's sort of the flu shot mentality that, from year to year, the flu shot doesn't always 100% prevent you from getting it or carrying it, but it's almost 100% across all three of the currently approved vaccines, making sure you're not going to end up in the hospital and you're not going to die. Which at the end of the day, that last metric of didn't die is pretty solid metric.
Absolutely, that's the most important one.
Yeah, that's the big one, and these vaccines have been extremely effective. A lot of folks wonder, which one should I get? There's a little bit of difference. In fact, Pfizer's vaccine just recently got emergency use authorization, I believe, down to age 12. So that's fantastic to open it up potentially to a little broader population. But the Moderna and the Pfizer vaccine otherwise have extremely similar efficacy just overall and serve largely a similar population. The Johnson & Johnson vaccine, the J&J vaccine seems to have a little lower efficacy at total prevention. But again, when you look at the end game of do you end up in the hospital, do you end up dying, it's still extremely effective in the upper 90s, which is, again, that's the game in the end, is keep you out of the hospital and keep you from losing your life.
Absolutely it is. And vaccines now, I know we were doing different stages of getting the vaccine. Are we kind of now open to everyone at this point?
It is now open, yeah.
Okay.
It is now open. Now, there's a little bit of variation in a few counties, but for the most part, it's wide open. And actually, most of the state's counties actually now will allow you to be a resident of a different county and still get your vaccine. Say you work in a different county, you can now get the vaccine still where you work, and nobody's they're not following that quite as closely now that we have so much more vaccine availability.
And is there still an issue, not really an issue, but with people getting the vaccine who had COVID having some flu-like symptoms for a couple of days?
Definitely still seeing that, but I will say uniformly, and I've talked to a lot of people, and uniformly it seems like it's just really short-lived. I mean, you feel terrible, but it's 12 to 24 hours, and it's like it's gone just about as fast as it hit you. So it definitely is a vaccine that triggers a really solid immune response, which makes sense. I mean, we're seeing how effective it is at preventing the disease. To get that efficacy, you got to trigger an immune response.
Right.
And so it makes sense to me that this is a vaccine that people tend to have a fairly vigorous aches and low-grade fevers and those types of things, but remarkably short-lived. It's kind of amazing to me how many people go, I felt badly the next day, but within 24 hours I wouldn't have known I had it other than maybe a little still sore arm.
All right. Well, thank you very much, Dr. Jennings, and we will look forward to talking to you again as we get a little more involved, okay?
Please, and if there's questions, I'm happy. Hopefully, I think I'm back with you maybe in a week or so.
Yeah.
If folks get you guys some questions, I'm happy to answer those.
All right. Thank you very much, Doctor. Have a good day.
You too. Bye-bye.
Have a good day.
You too. Bye-bye.